And so welcome back. So in today's video, we will be discussing sleep apnea. There's a lot of language and a lot of concerns and questions out there about sleep apnea. What is it? What's a CPAP machine? How do you get it rated and so forth? So today I'm with Dr. Nguyen, who serves as our DBQ expert, our medical doctor here on staff. She's amazing what she do. And she's the brains of how to put this stuff medically. So Dr. Nguyen, what is sleep apnea? What does it require? And how do veterans even go about this?
Yeah, so sleep apnea is essentially abnormal breathing in the sleep with multiple extended pauses while sleeping, which affects the body's oxygenation level. There's actually 3 types of sleep apnea. The first is what we normally deal with, obstructive sleep apnea, where there's actually something physically blocking the back of the airway when the patient is asleep, decreasing oxygenation.
So that's the part where when veterans are asleep and they stop breathing, that's a blockage.
Yep, that's the cause of it.
Okay.
And then there's central, in which there's actually something wrong with the brain or brainstem controlling the breathing itself, like the muscles of respiration. And the third is central or mixed, which is central and obstructive together. So pretty much their symptoms are commonly excessive daytime sleepiness, irritability, morning headache, really dry, sore throat when you wake up, attention issues, obviously loud snoring that can even be interpreted as choking, stopping of breathing overall, and even a need to wake up throughout the night to urinate just from the effects on the kidneys during sleep apnea symptoms. The causes can be anatomical, so the way your head is positioned, your jaw is positioned, the tongue, the tonsils, those things can block or cause obstruction to the back of the throat. Obesity is one of the most common causes of the sleep apnea as well, because it causes the narrowing of the airways.
So if a veteran is obese by, I guess, American standards, if they were to lose weight, could essentially that heal a sleep apnea condition, or is
it depends, because obesity can also be related to other conditions like low thyroid function, which can cause the tissues in the back of the throat to swell up, which still causes the narrowing of the airway. And then there's also cigarette smoking, family history contributes as well. And then sedatives like alcohol use and other medications the veteran could be on also. So losing weight itself can help with improving those health conditions, but at the same time, the family history contribution, so it's kind of a mixed bag.
So there's a lot of factors here. A lot of factors, okay.
Yep.
So veterans out there that are looking to do a sleep apnea claim, obviously we have to have evidence to make sure that we can win a sleep apnea case. But more importantly, I want to share with you how the VA rates sleep apnea. And so I'm going to refer to my notes here. It rates at 0, 30, 50, and up to 100%. Typically here in the firm, we find a lot of our veterans fall at the 50% level because they may have a CPAP machine that's been prescribed to them and they've been, of course, successfully using it. So veterans out there that are asking about the CPAP machine, if you don't have one, I would recommend you go get a CPAP machine if you have a diagnosis and be seen by the VA for that condition as well. Now, at 0%, it's an asymptomatic but with documented sleeping disorder breathing, meaning that during your sleep, there's a disorder in regards to how you sleep for that condition. On the top end, which is where most of our clients fall, 50%, is the use of a CPAP machine that is required for breathing assistance. And of course, at 100%, there's chronic respiratory failure with carbon dioxide retention that requires, of course, ongoing treatment and so forth. So for those vets out there that are suffering from these conditions, as Dr. Nguyen has mentioned, and you also have documentation of this, you may want to give us a call sooner than later to make sure that we can get a service connected. Now, Dr. Nguyen, before we end this video, if a client, let's say if it's a veteran served from 2000 to 2010, and here we're in 2021 time frame, and they wait until 2025, but they have gained quite a bit of weight. They have the use of nicotine as well. Do you think that may hurt their ability to get a diagnosis for sleep apnea, or do you think that they have a good chance?
I think they have a good chance.
Okay.
Just go be evaluated and know based on your symptoms and see how it has impacted your life as well.
Okay.
And that will result in the outcome and maybe even recommendation to try out the CPAP and see if that helps the condition.
Awesome. Well, guys and gals out there, I hope you found this content great. This is wonderful information. As expressed before, getting evaluated is the most important part. More importantly, getting evaluated early and often is in your best fit to make sure that we as claims practitioners can get the actual benefits for you, which is money in your pocket each month for the rest of your life. Join us on our next video, and I'm thankful for you guys being here.